Hi, Steve Lynch here. I'm a licensed massage therapist, better termed clinical medical orthopedic massage therapist, neuromuscular therapist. And I'm talking to you live from Limestone Therapeutic Massage here in Newark, Delaware. And the reason I'm making this video today is simply to better define what it is that clinical or medical orthopedic neuromuscular therapists do, what our purpose is, and why it's important to have us. We are not the average massage therapist. If you can look behind me, you can see these muscle and bone charts. So these are very basic charts that some therapists use, but by and large, therapists like me, we are the people that get called in when there's sports injuries or surgical recovery, some type of injury prevention, or just a need for better athletic performance or better pain-free range of motion. So the work we do generally isn't your lay down and go to sleep kind of work. It's I don't think I've ever had anyone, well, there was that one guy, and I had to wonder about him, because the work that we do can be a little discomforting sometimes, a little uncomfortable, but by and large it's not something that you can't stand, that's so painful that you don't want to go through it. Basically, we're working with scar tissue, old injury, stripping of yellow collagen fiber off tendons, sheaths, and separating fascia. In fact, it's not unlike Rolfing in a way. Some people have equated neuromuscular therapy or clinical massage therapy with Rolfing. And it bears some of the same principles. What we're actually working with is trying to increase the mobility of the structure, the pain-free range of motion. And what does that mean to you, the client, or you, the physician? Well, let's start with the physicians. If you utilize the skill sets of medical or orthopedic massage therapists as a physician, your practice is going to be enhanced, because you don't really have to worry about the post-surgical or the post-treatment care of your clients so much, because they're going to be in great hands. Normally what happens with surgery is that the procedure is done, and if need be, physical therapists are brought into the scene, and they are utilized for a number of weeks as the insurance protocol will dictate, and the patient is then given their marching orders, and they go home and they summarily forget everything that the PT gives them. So in actual fact, they don't get the kind of post-treatment that they need. It's not something that the average person thinks about on a daily basis, of how their exercise or lack of exercise is going to affect them a year, 5 years, 10 years down the road with their particular injury, illness, or surgery recovery. So that's where we actually are very effective for physicians, chiropractors. They need us because we do the prep work, we do the grunt work. We make it so that the tissue is very accepting of the articulation process. And so we're good for chiropractors for pre-articulation treatment or post-treatment soothing, and or in adjunct to the chiropractic articulative process itself, in helping that client establish that range of motion, open up the foramen, and get the nerve function going the way it should be. So what does it mean for the average person? the average person, we can look at that and say, okay, I'm just not moving like I should be. What can I do? I try to exercise, I try to eat right. Well, the simple truth is that, we've got about 600 muscles. Each muscle has an attachment, so we're looking at 1,200 attachments, 206 bones. So, we're looking at about 1,800 potential, basic potential points of interest or points of distress or points of dysfunction, and that's just the attachments. So we're not even really discussing the overall musculoskeletal system and connective tissue system head to toe, which, as you can see in the chart behind me, is quite extensive. So, we're not the people you call to go to sleep by. We're not the people that you call once a year to give a gift certificate to. We will do that lighter, fluffier kind of work if we're forced to. But by and large, people like us like helping people like you.